Librium, or chlordiazepoxide, is a benzodiazepine used primarily to manage anxiety disorders, alcohol withdrawal symptoms, and sometimes preoperative anxiety. It is one of the first benzodiazepines to be discovered and is often favored for alcohol withdrawal because of its longer half-life. Librium, like other benzodiazepines, enhances the effect of gamma-aminobutyric acid, or GABA, an inhibitory neurotransmitter in the brain. It binds to the benzodiazepine site on the GABA-A receptor, increasing the frequency of chloride channel opening and resulting in hyperpolarization of the neuron. This leads to central nervous system depression, which manifests as sedative, anxiolytic, muscle relaxant, and anticonvulsant effects. Librium has a relatively long half-life, which is one of the reasons it is often used for alcohol withdrawal treatment. The half-life of chlordiazepoxide itself ranges from 5 to 30 hours. However, its metabolites significantly prolong its duration of action. Common metabolites and their half-lives. Librium is metabolized in the liver into several active metabolites, which include 1-desmethyldiazepam, also known as nordiazepam, a long-acting metabolite with a half-life of 36 to 200 hours. 2-oxazepam, a shorter-acting metabolite with a half-life of about 5 to 15 hours. 3-temazepam, another metabolite with a half-life of 8 to 22 hours. The prolonged half-lives of these active metabolites contribute to the sustained effects of Librium, particularly useful in managing alcohol withdrawal symptoms over a longer period. Effects on COPD patients undergoing alcohol withdrawal. In patients with COPD, Librium poses some risks, particularly in the setting of alcohol withdrawal. Since it causes CNS and respiratory depression, it can potentially worsen the respiratory function in COPD patients. The sedative effect can suppress the respiratory drive, increasing the risk of hypoventilation, which can exacerbate respiratory insufficiency, particularly in those with more severe COPD. Careful monitoring of respiratory status is critical in such patients, and in some cases a shorter-acting benzodiazepine may be preferred. Difference between Librium and Ativan. Both Librium, or chlordiazepoxide, and Ativan, or lorazepam, are benzodiazepines, but they have several differences. First, half-life. Librium has a long half-life, 5 to 30 hours for the parent drug, with active metabolites lasting much longer. Ativan has a shorter half-life of about 10 to 20 hours, and it does not have long-acting active metabolites like Librium. Second, onset of action. Librium has a slower onset of action due to its longer half-life and metabolism. Ativan has a faster onset of action, making it more suitable for rapid symptom control in acute settings. Third, metabolism. Librium undergoes extensive liver metabolism, producing active metabolites that extend its duration of action. Ativan undergoes simpler metabolism, primarily glucuronidation, making it safer in patients with liver disease. Fourth, clinical use. Librium is often used in the treatment of alcohol withdrawal due to its long half-life, which helps to prevent the rebound effects that can occur with shorter-acting drugs. Ativan is also used in alcohol withdrawal, but is preferred in liver dysfunction or in patients requiring quicker onset and shorter duration of action. In COPD patients undergoing alcohol withdrawal, Ativan may sometimes be preferred due to its shorter duration of action and less risk of prolonged sedation and respiratory depression. However, both medications require close monitoring of respiratory function.